Hi, good morning. Welcome everyone to our Steps Forward Innovation Academy Future of Health session today. This is our second to last session of the year, and we're excited to have a great group of physician panelists here to chat with us about the work they're doing as healthcare innovators and their experiences making connections with providers and entrepreneurs that are driving the future of health. This is our disclaimer. I'll hold this up for a quick second. For our agenda today, since we're nearing the end of the year, we're going to go over a little recap of some of the work that we've shared this year and some updates for next year. Amanda Zadian is actually sick today, so I'll be sharing some updates about the Physician Innovation Network and then some more general digital health strategy updates from the AMA. Then we'll go into the panel discussion, and this is going to be kind of, if you've heard of our Physician Innovation Network in real life sessions, physicians that have participated from them. We'll have Dr. Vimal Mishra be the moderator for that session. And then if there's time, we will have audience Q&A, so feel free to drop questions in the Q&A box as they come. If there are questions about things that I present, I can answer them as well, so feel free to ask questions throughout. So we've had 9 webinars released this year and 4 podcasts covering various topics from digital health disconnect, health e-consults, digital therapeutics and behavioral health care, extended and virtual reality, and AI. These sessions varied from peer-to-peer to clinical case studies. We also had a few podcasts revisiting our 2020 Return on Health case studies. So this was looking at the digital health and telemedicine programs at various organizations, and they used our Return on Health framework to kind of see where these programs and orgs are. And we did a comparison then in the podcast to see how those programs are doing today. For our Future of Health work, I'm going to share some high-level updates from 2023, as we've had specific webinars that have delved into some of these topics in a little bit more depth already. As a reminder, we released a report in 2022 that creates a blueprint to address the digital disconnect and achieve optimized digitally enabled care. So as we continue this research, we released a brief on health at home, which builds in our existing digital health playbooks and reports. The report provides a framework for the various types of care that can be provided in the home and outlines some key considerations for practices and health systems that are exploring health at home programs. Based on talking to practices and organizations and companies that are building these programs and using them in the real world today. To learn more, we have the report linked in the widget, but you can also watch our previous webinar that includes a panel of several of the brief's contributors. It's called Delivering Health at Home Through Innovation and Technology. That's on our YouTube. And Dr. Vimal Mishra, who you'll hear from later, was on that session as well. So feel free to listen to that or go and download the report if you'd like to see more about that. That initial report that I mentioned, The Future of Health, it outlined foundational pillars to optimize digitally enabled care. And one of those pillars is to improve and adopt payment models that incentivize high value care. So one of our latest briefs that we did with Manat Health delves into this by looking at commercial payer coverage of digital medicine codes. This brief looks at the digital medicine code coverage across 16 commercial payers and shares what this existing landscape looks like, as well as what the decision-making process behind them looks like. Here, there's a lot of variability across the board in regards to the timelines for adoption for these codes, as well as variability in the transparency of what's covered. I encourage you to take a look if this is something of interest to you. This is also linked in the widgets. And then looking to 2024. As part of our Future of Health work, we have several items that we're nearing completion. They'll be released in the coming months here. So firstly, we've been aggregating case studies of successful collaborations between physician practices or health systems and digital health companies. We'll be releasing 5 of these case studies in the new year, looking at kind of best practices, what's working well with those partnerships. Additionally, as we're seeing an increase in the partnerships between brick and mortar health care organizations and digital health companies, we want to make sure that we're reducing fragmentation and by having seamless and secure data exchange. So we're planning to release another brief on data sharing and interoperability. This brief incorporates input from a variety of stakeholders during an interoperability and data sharing workshop that we hosted. And that includes health systems, physicians, EHR vendors, and digital health companies. And essentially just compiles various imperatives of how to do this well, how to make sure it's kind of seamless and data sharing is happening and seamlessly. And finally, we have lots of work coming out around AI. Our advocacy team recently released new principles for augmented intelligence development, deployment, and use. That came out a few weeks ago. Additionally, this morning, we released survey data from a survey that went out to over 1,000 physicians, asking them their perspectives on the use of AI, including motivations, opportunities, concerns, requirements, and current uses. To share a quick highlight, interestingly, you'll see that there's a fairly even split between physicians who are excited for the potential of AI and those are concerned. So questions that we put out to those physicians. So again, I encourage you to go look at that, and we did link that in the report. And then finally, we are working on a landscape report looking at the potential of AI, and we'll outline considerations for physicians who are considering using AI tools. So that'll be a more comprehensive landscape report that will go out in the new year. One other programmatic update, we're excited to be migrating this program under the STEP Academy. Our content has always been there, but we'll now be listed under the Future of Health track or topic area, so which is also linked in the widget here. You'll now have access to other content on this hub, including resources and webinars for behavioral health integration, private practice, EHR improvement, and patient-centered care. And that's just a few of those. There's others as well, so please check that out. The link is in the widget. We will still have our YouTube page as well. That will remain up. As I mentioned, I'm going to share on behalf of Amanda Azadian on the Physician Innovation Network. However, she is present, so if you have questions about this, feel free to drop them in the chat and she can respond to you directly. So going back to 2016, the AMA conducted research to better understand the trends in digital health adoption. The QR code here will give you the link to that full report and the kind of summary of it. But in summary, negative forces impacting physicians and care teams were seen as increasingly overwhelming. And so you can see here all the different ones that were happening: quantity of and pace of work, excessive documentation, professional liability. So kind of from this research, 4 key questions were, there were 4 key requirements, for technology adoption for physicians. Does it work? Will I be liable? Will I receive payment? And will it work in my practice? And then ultimately, when physician solution designers don't get this feedback, their products will suffer, solutions will suffer, and ultimately the end user is not going to have a product that's workable for them. So kind of the goal of this, what I'm going to share here, is making sure we're getting that physician, provider, end user feedback early and often in the development of new technologies. So then enter the Physician Innovation Network, which was launched in 2016 and is essentially kind of a large-scale asynchronous matchmaking platform that allows providers, clinicians, physicians to connect with those solution designers early and often when they're developing solutions. Here's the QR code for it. We're over 19,000 users now, lots of connections being made. And it's now in its second year of being turned kind of from a platform. There is now an in real life component happening at conferences across America. So at these conferences, we call it the PIN in real life event. And essentially we have 10 physicians that we have brought with us. There's a few of them that you'll get to meet today. And then we identify companies that get to share time on the stage and share a little bit about what they're doing, what are their interests. So for the clinicians, what is your experience, expertise holistically? What patient experiences and stories keep you up at night? And what connections are you hoping to make? And then we have the solution designers. What are you solving for? Tell us about your design. And then what questions do you have for clinicians and for physicians? So we get them on the stage to kind of have some facilitated matchmaking, and really have had some really fruitful discussions and made a lot of great, pushing things forward and getting physicians involved in the creation of new technologies. So as I mentioned, there were 6 this past year. We'll be doing this again next year. Applications will be opening. I'll share that information in a second. But if you're a provider that's interested in participating, you're welcome to apply for this. And if you're accepted, we will comp you a registration for a conference and then give you a small stipend to come and be at the conference with us. So as I mentioned, kind of next steps for this, we have these PIN community office hours, and this is a chance for you to come and learn more about the platform. How can you optimize your engagement with the platform? How can you post opportunities? We call opportunities are basically the area where you ask your questions of the providers. What I need help with this for my solution building, and I'm looking for a radiologist, for example, that can help me with this. So that's where we find opportunities. So community office hours, feel free to join. They're every Friday, and you can learn how to better engage on the platform and connect with other folks that are using it. Applications for Vive, that's the next large one that we have, will be on December 29th. We will share that application with you all following this event. You can also go to the Physician Innovation Network, and we have posts regularly about all of this. Also opportunities, as you know, we're promoting a large-scale conference. Now's a great time to share, put a profile out there, let people know what you're looking for, posting opportunities on the platform right now. And then in January, we're calling Pain Management Solutions, posting opportunities for the AAPM collaboration. This is for a conference, so feel free to, if you work in that space, to add opportunities. And then also we'll be accepting applications for ATA 2024. So keep an eye out on PIN for all of this. And then I'm going to pass it to Dr. Mishra to moderate our panel with our physicians that have participated in those PIN in real life events. Dr. Mishra is a director here of digital health at the AMA. And thank you, Vimal. I'll pass it to you to introduce our panelists.
Thank you, Laura, and thank you, Amanda, as well. I know you're not feeling very well, but really appreciate this opportunity. And I have a great privilege of introducing three amazing and fantastic physician innovators and a fantastic panel. And I'll start with myself, and I'll say I'm one of the directors at AMA Digital Health, and I also am an Associate Chief Medical Officer at University of California at Davis. And I'm going to ask if all the three panelists take turn and introduce themselves, and then we can get started. It's a really exciting day today here. So I'll start with Dr. Gotkiewicz. Please go ahead and introduce yourself, please.
Hi, everybody. Thanks for having me. I'm Dawn Gotkiewicz. I'm a pediatrician. I worked for 25 years for a large conglomerate of pediatric practices outside of that were related to Children's Hospital of Pittsburgh, UPMC. About 10 years ago, I delved into the behavioral health space and worked with educating pediatricians on bringing behavioral health into primary care, not just screening, but actually real solutions. And we worked really hard on that for some time. I now have a private office in the behavioral health space where I can bring lifestyle care and mind-body medicine and general pediatrics into that space to help catch some of the things upstream. I joined PIN this year. I went to health, and I'm happy to be here.
Dr. Dillard, if you want to introduce yourself and tell your story.
Sure, absolutely. Thanks also for the invitation to participate in this panel. I am Erika Dillard. I am based in Memphis, Tennessee. I did my graduate work in my medical school here in Tennessee and went on to do part of a neurosurgery residency in Philly before I came back to Memphis to do a non-clinical fellowship specifically focused in commercialization of intellectual property. So I'm one of those guys that did not finish residency, so I've not practiced independently as a clinician, but I came out of that fellowship in developing a company from the technology that we created there. So my company's name is PopCheck Technologies, short for postoperative check, and we are focused on improving outcomes during the surgical episode of care. I'm sure we'll talk a little bit more about that specifically. So. Happy to be here. Thanks.
Thank you, Dr. Dillard. And Dr. Kike Oduba. I think you're on.
I think you're on mute, Dr. Oduba. Can you hear us?
I did not realize. Sorry about that.
Oh, thank you.
Okay. Hi, everyone. It's a pleasure to be here. Thank you for having me. I am Kike Oduba. I am the founder CEO of WellnessWith. I am a physician, innovator, entrepreneur full-time, and my background is in public health and epidemiology. I've helped federal and state and local public health agencies in Texas mostly to mitigate infectious disease outbreaks. But at the moment, I'm working solely on our digital health platform at WellnessWith, which I guess we'll talk more about as we go along.
No, thank you. Thank you very much for the introduction. So today we are meeting and talking about in real life event, and we are continuing that journey to talk about the innovation you all are leading and how you are, how the Physician Innovation Network is enabling and enhancing it. So would love to kind of start with this question in terms of how did you get involved in health tech innovation? And the story behind it. So, Kike, if you want to start first and talk about it.
Sure. Myself being a very curious person, I've always thought outside of the box. And when I see things, I'm always looking for ways to make something out of something else that I've used that I love. Hence, being on social media has kind of been of something of interest to me. When I was diagnosed with a chronic disease myself, I went on social media looking for answers on how did people who have lived the same experience navigate their health problem. And so through that, I gleaned a lot of understanding of how people communicate in a social platform. However, it concerned me that doctors were not in the forefront of innovation as it relates to healthcare consumerism on social media. So that's how I got into health tech and digital health, wanting to create a platform for doctors to connect socially with groups of patients with similar health problems. So that was my inroad into healthcare innovation and technology, but I'll discuss more later how the company or the solution has evolved.
Thank you. Erika, you want to answer the question around how did you get involved in health tech and innovation?
Yeah, absolutely. So it'll probably sound corny, I'm sure, but honestly, I got into healthcare tech just by not fighting against where my road of life took me and learning to really just embrace, I would say, the pivots that I've had along the way. I, like most, started off my medical career actually doing a dual degree program and was solely focused on being a physician scientist, where in my head that meant I would be, essentially doing research and, in my area of practice and then have the opportunity to kind of dabble in technology after I was practicing for a while and after I become more established. And so after graduation, I went on, like I mentioned, to do neurosurgery residency. And I quickly learned that reality is there's really a lot of factors. There's many more barriers and opportunities, I would say, that influence your ability to really, truly do research at the same time as practicing. And even more, I kind of felt like the implications of being involved in industry seemed to carry kind of a negative tone. And as a resident, the one group I would say of physicians that I observed who did this really well were in the orthopedic space. So, shout out to the orthopedic surgeons who are on here. But I just kept note of that to help really, first of all, shed light on my reality and what might be possible for me going forward. So I had a huge pivot, as I mentioned before, I had a huge pivot in residency, and I ended up not completing my program, but entering into a non-clinical postdoc fellowship here in Memphis that was essentially teaching people who had a medical and research background how to commercialize intellectual property. And it was something that I found to be extremely unique, particularly because, again, my thinking was that timeline was from school to residency to, fellowship to practice, and then maybe dabbling in tech. And it was through that program that I would say my eyes were truly open to how I might be able to use my unique skill set and knowledge as a physician to reach more patients than I felt like I could in the OR, even in the lab. So it was really through embracing that exposure that I had through something that I didn't imagine that I was going to have access to.
That's a fantastic story. That is amazing. And you didn't follow the traditional pathway from, medical school to residency to starting practice, then, becoming, doing in tech. So thank you. That was fantastic. And Don?
Yeah, so I didn't expect to be in the tech innovation space. It kind of found me and I found it, but it was actually in searching for a solution. I did my medical school at Johns Hopkins, and I was always thought to think out of the box and bust barriers if they were the right things for my patients and not be afraid to do new things within reason. So I've kind of always practiced that way. And once my kids were grown, I took on the things we weren't good at. And that was the behavioral health space, which has been a really difficult thing for primary care, as well as transition to adulthood, transition to college. And I stumbled upon tech because I applied for an innovation project where I actually was involved in making my own app. I worked with some of the developers at University of Pittsburgh and also through Western Psychiatric, the group that works on suicidality. And we did a little transition to college app for people to check in with themselves, because I always felt like we needed to catch things upstream rather than waiting till they were downstream and super serious and difficult. And primary care is actually the place to do that. We're just kind of afraid of it. And actually, most of the things that we need to do for these kids, we already know how to do. It's not, I'm very good with medications now, but that's not actually the main answer. The main answer is lifestyle and asking the right questions. And we're capable of doing that. But another problem we had is that we do all these screenings, but then we don't know what to do with our screenings. And so I developed different tools that pediatricians could use so that if people screened a certain way and they were really having trouble with sleep, we could actually give them information about sleep and lead them in the right direction. And that proved to be really, really helpful. But given the kind of, excuse me for saying, corporate takeover of primary care, I mean, we're all like so stressed as far as time and frustration and burnout. And if we have to take 3 additional clicks, it's like asking us to solve all the world's problems. And so I was looking for ways to reach people where they were at, whether that's they didn't have access to care, whether that's they culturally had stigma against care, whether that's that they just needed something to get them to their therapist. And in that, I started looking into different kinds of apps. The pain clinics were really good about that, and I started with those. I met some people from different companies, started working with them, and kind of got into this, and then was introduced to PIN and a whole community. I didn't even know what IRL stood for until a week before I went to health. So I, really am not somebody that anybody thought would be in this space. But I think that's helped because the people who know me have seen me over the past year become involved, and I think they're less afraid of it.
Thank you. That's such an amazing kind of a way. It sounds like what you're saying is you were always taught in medical school to kind of bust the barriers, and now here you are doing that. With everything else going on, right, with so much of burnout going on, industry in crisis in so many different levels, from access to cost to clinical care to quality and safety, how is your innovation and the work you're doing is solving the problem? What are the problems you are solving with your solutions, clinical problems? So maybe you can start there, Don, and we can kind of
Sure. Yeah, no, I'm happy to. I think what it has allowed me to do is get more skills to patients in less time. If you find the right people to work with where things are simple to execute, it's allowed more kids to be less afraid. Something that they can actually do on their phone, they're less afraid of. It seems more private, but it makes them feel more comfortable if they end up needing to go to therapy or end up needing more skills. It's been super helpful for me for kids who don't have access, whether that's that the parents don't have the means to get their child to counseling, or they don't have decent internet, or culturally there are barriers to counseling. But overall, it's also helped me get back to lifestyle medicine, which I think in primary care is such a huge benefit. Focusing on the simple things like eating healthy and eating your meals rather than waiting till 4 o'clock to eat if you can, sleep type things, or even just learning about ways to navigate life right now, which can be really hard with social media.
That is great. And Kike, if I can ask you, what clinical problem you are trying to solve and how?
Yeah, thank you for that question. So the problem we're trying to solve on the consumer side is healthcare consumerism and misinformation. And so I had mentioned earlier that my platform was inspired by my activities on social media, and to bring it to a better perspective, I joined a group on Facebook called the Hypothyroid Mom, looking to learn what people's lived experiences were after they had taken out their thyroid. And then that group, I found over 1.2 million people were on that group sharing a lot of information, some good information, some not so good information. But the key there was the fact that many people had very negative narrative towards their doctors. People kept saying, my doctor doesn't spend enough time in an appointment. They keep increasing my dose, but they're not answering questions regarding how my nutrition is affecting my medication, how is my sleep affected. So all of those things are social determinants of health factors that doctors don't really have time to address in a time-constrained one-on-one appointment. And so after, studying this dynamics, the dynamics amongst people who are on social media talking about their doctor and then sharing information that potentially can be harmful. I mean, imagine you have a platform of 1.2 million people and you share something there. What percentage of the people there would take up negative information that could potentially be harmful? But then they get into the doctor's office and say, hey, I learned about this online. How about that? I hear this drug or this herb is going to help me. Not to say anything against herbs. I use them when I need to. But the point I'm trying to make is that people share a lot of misinformation online. So with all of those learnings, I decided, how can we help doctors connect with patients, in groups or in socially enabled environment that they can safely share information and the doctors be the source of truth rather than, folks who are not medically licensed or people who are not credentialed to share health information. And so with that, we decided to create Wellness Suite, which is a one-to-many digital health platform for shared medical appointments. The key there is shared medical appointment because I thought, what would be the incentive for a doctor to want to spend time on social media with patients, right? Or why would they want to talk to a group of 20 people who have the same diagnosis? Come to find out that this is a care delivery model that has actually existed for over 10 years. Typically, you see a doctor who is seeing patients in a rural area where there is no clinic for that particular specialty. Say maybe a neurologist traveling to an FQAC to see groups of patients because it's 3 hours away from the doctor's house. So what they do is they gather maybe 5 to 10 people, have a group consultation, and then the doctor can do individual, assessments of each patient. By the end of the day, the doctor gets paid for the whole group, despite the fact that the doctor spent an hour with all of them. What is good about that is it actually saves the doctor time. It also helps with increasing efficiencies with documentation because there was a collective encounter that happened with people with similar diagnosis. So all of that put together has helped us, fine-tune how we can help increase clinical effectiveness for doctors, save them time for documentation, reduce the administrative task burdens, and also, help them reduce their propensity to be burned out because they're seeing such large patient volume. So on the patient side, it's more of increasing their time spent with their care team without burdening the doctor too much, because then the doctor is killing 10 birds with a stone, if you know what I mean. So those are the problems we're looking to solve. And I guess over time, as we apply more technology like AI and ML, it would help us learn how to personalize care for people who are in groups.
That is very exciting. Erika?
Yeah, again, great question. As a resident, I remember how, extremely cautious we were during the post-op phase of care when, we're like really anxious about the patient developing certain post-op complications, and to the point that we make all these alterations to protocols for that post-op phase, some requiring additional labs, imaging. And if a patient, ended up developing a complication that was catastrophic, we'd essentially change our whole way of doing things for that one instance. And now everybody gets a certain preventive measure or workup to prevent it from happening again. And so it's like this super kind of practice of defensive medicine almost. And an example I give is that we get patients ultrasounds every week if they were in the hospital, just to make sure that they weren't developing a DVT, no matter what they were there for. So essentially the hospitalization itself was the indication for the study. But then, patients go home after that, and we have no real way of knowing what's going on with them on a day-to-day basis. What, we put in place to optimize them for surgery is now kind of less of a priority. And we never really factor in essentially those social and economic factors that a lot, our two other panelists spoke of so eloquently today, how that influences, ultimately influences their outcomes. And because I would say the neurosurgical population that we were taking care of was so high risk for venous clots, I began to focus on, at that time, kind of, what is the patient's journey post-op? And how do we monitor for those complications, or really what the lack thereof of monitoring strategies that are actually feasible and, economical, that could save time, could save, on costs, and ultimately save the patient's life. So as a medical device and digital health company, we are really focused on that, developing, first of all, a virtual care platform that integrates novel wearable devices that will provide more insight into the patient's recovery, specifically during the surgical episode of care, that allows us to implement data from the patient health information in combination with those social determinants of health and biometric data that we receive through devices like our VT monitoring device, which we are actually developing in parallel. And so this gives a more accurate risk assessment. So we're not missing those high impact diagnoses, and we're not missing an opportunity to implement management that is more appropriate for the time and the place where the patient, truly needs it. So.
That is so wonderful. Thank you so much for sharing. And those are really sticky problems you guys are trying to solve. And kudos to you for thinking about this. And as a physician innovators, you are blazing the trail. So really appreciate that. We are talking about Physician Innovation Network here. And I wanted to kind of get your thoughts on how did you get involved in Physician Innovation Network, and how did PIN helped you develop this solution, and tell the story about what value PIN has created for you. So maybe Erika, if you want to get started, and then we'll pass along.
Yeah, for sure. So I would say, again, I think stemming from some of the issues that I talked about, in my experience, thinking that I was going to be a physician scientist and really not having that space to really carry out research, during training and beyond. The same thing for, jumping into industry or getting involved in healthcare technology is just, number one, the exposure and the network is important. And I would say that PIN really helped me create a network that I felt I didn't have in the early stages of my career, my training. I became a member of PIN back when I was a resident, just to see what people were posting and to see what opportunities were actually out there for someone at my stage in my career. To see how I might be able to tap into those and learn from others that were really starting to get into the space. And like I said, I didn't complete residency, but once I left out of my program, or came out of my program into a different program that was non-clinical and focused on entrepreneurship, that really flipped. And so I had an opportunity to take part in PIN in another capacity as an entrepreneur in the healthcare space. And my first, I would say my first involvement from that perspective was at Vive this past year. I had the opportunity to apply for the PIN in real life. And it's actually where I met Dr. Oduba at that first event. And so really now having this core network of people who were similar to me, had the same background, really focused on creating strategies and solutions for things that we actively saw every day, as clinicians was super important, bringing a totally different perspective into innovation. And it also allowed me to tap into those who were actively practicing, to see who was out there and interested in collaborating too, which obviously for healthcare technology really is something that's important to have, are those supporters, those clinical stakeholders that are enthusiastic about what you're creating. So
that's wonderful.
I guess I so just to shadow what Erika had just said, you know, we did meet at Vive and we've become good friends. You know, Erika had sent referrals to me and we've shared resources. So that's the power of connection through the AMA PIN network. And so I got involved through our Chief Operating Officer, Jim Sinclair. He has a mutual friend who knew Amanda, I think. And so they got talking and we got a link saying apply to be part of the PIRL event at Vive last year. And that's how I got on stage. And it was such an amazing experience. Right after the event, we got about 4 to 6 doctors who came to us very interested in what we're doing. And we had follow-up meetings and conversations and with commitments from a few of the doctors who wanted to be advisors, you know, with us in our company, even being on the platform, on the digital health on the digital platform for PEN as well. We've had people reach out to us saying, hey, we think what you're doing is interesting, would like to learn more, and we've had meetings that way as well. So the AMA has been a great resource for us. And just to allude to what Erika had said, it's just amazing to build a community around what you're doing, having like-minded entrepreneurs who have the same background. You know, they're medical doctors who are trying to solve for medical professionals. It's a different, you know, environment you find yourself if you're not, you know, in the industry, but you're trying to solve for the industry. So we're uniquely positioned that way, all 3 of us, to be able to glean from each other's experiences, challenges, and future ambitions. So
that's super.
So PIN has been an amazing experience. It taught me that it's okay to think out of the box. It's okay to open my own practice and do things the way I'd like to do them, which after 25 years was hard to do. It taught me there's a lot of other like-minded people, both from the physician level as well as people starting businesses, people doing startups who have just best interests in mind. You know, there's a group I met that's making a new telehealth platform so that kids can engage better. And I just think it's wonderful that people have such amazing ideas. Going to health really opened my eyes into everything that's out there. And I made some very good friends there too. And it's wonderful that we're still having these conversations. I think it made me less afraid to reach out there and do things the way I know they need to be and the way would benefit my patients the most, even though it's not typically the norm. But it also made me realize, especially going to health, that there's a lot of difficulty on both sides. I have definitely worked with a lot of physicians that are afraid of the digital space. And I myself feel that especially my interactions with people are very important. And I don't want anything to be replacing my brain. I want them to be an adjunct to what I do and make me better, but I don't want them to replace me. And I've been very vocal about that. And I think we can do that by working together. And it's interesting because I feel like there's innovators that get these ideas and they're phenomenal. And then there's the people who are really trying to do things in practice and have a lot of structure and a difficulty sort of breaking away from that. And I feel like conversation is really the biggest part of all of us coming together. And it's really hard to understand what primary care physicians are doing kind of in the trenches, so to speak, without being there. But it's also so fascinating to hear the things that are on the horizon. And I really, truly believe there's ways to come together so that it helps everyone. I just think it needs to be that conversation so that we all understand each other. And I think PIN is the first step in doing that. So I really thank them. Amanda even has me writing, which is amazing. And I have a LinkedIn, so it's all good.
This is great. No, thank you. It sounds like, the typical network effect, the Physician Innovation Network, where we have physician innovators, physicians, tech leads, as well as venture capital teams and funders are all in one place. And what can be better than this, where most of our physicians and clinical colleagues are thinking about new innovative ideas to come and pitch and think about how they can create that team which we always wanted and get some ideas. So no, thank you for sharing that. This will be my last question from all three of you. It's a two-part question. One, how are you involving physician and a care team in your solution? And how are you looking to implement your solution into the clinical practice? Do you want to go next, Don, or you want to?
So I think that the biggest hurdles that we have with primary care are comfort level, fear of liability. I think talking about it is the biggest part of breaking that down. I compare it to, we often recommend that kids join a club, or they they sign up for a certain sport, or, we talk about these things, but we don't worry about who those people are going to be there. We trust the parents to navigate that, or we help educate about it. And I think this is, it's a new realm. And I think it's something where we do need to meet people where they are. And there are some great solutions out there. I think as long as we're honest with our patients, and that's what I've tried to be. And, I try to use things that I recommend to people first. I tell them, hey, I really like this. I wish it did this. It's not a crisis line. And I'm just very honest. I can say that pretty quickly. And I feel comfortable that they can make that decision. So the other thing as far as implementing is really, I do believe it's modeling. I believe it's them seeing other people using it as a solution. And that way they see that things are improving, and they see that it's improving the flow. And I think that's the most important thing with primary care, is that solutions can improve the flow. And I do think that flow takes work on all sides in order to make the flow improve. So those are the main things that I'm working on.
That is great. Dr. Dillard, you want to answer the question around how you're engaging physician and the care teams, and how you're thinking about implementing your solution into the physician practices?
Yeah, and so it's a great question, because we're quite early in our stage of development. We literally just came out of an academic setting around this time last year, and so have really started to become an independent entity that is sustainable and supported through starting off with grants and moving into investment. And so the way that we are interacting with practices is really moving from are we addressing a problem that's really a problem for those clinicians that we're targeting. Again, we're developing a technology that helps to manage the postoperative phase of care during the surgical episode of care, and really starting with hip and knee replacement patients. So that orthopedic population, really starting to engage them at this phase for that validation and on the front end. And so understanding how through the patient's journey and we will be able to provide value. That's, starting at an early phase is really important, which I think is why PIN is so relevant and so helpful to us, because it provides a platform for us to be able to answer those questions. I mean, just recently it was Vive? No, it was Health in Vegas. Just recently at Health, I met 2 or 3 different orthopedic surgeons who had, wanted to talk more because they were having a specific problem. They were really focused on really being able to understand better how those social determinants of health are affecting their population, and being able to hear from them and even consider ways in which we can collaborate is really what's the most important for us at this phase. So I would say, another thing that has been super helpful and understanding how we might be able to address a specific problem for physicians who are in practice is the PEN network having individuals who have been involved in implementing digital health technologies, which is, a very, very new and open space that I think that we don't necessarily consider that user experience of the patient and the adoption side of it. That's the whole nother thing that I think has been super relevant for us, even to the point where, we had been solely focused on getting our device, our wearable device out and ready for pilots and ready for clinical studies. And having those conversations allowed us to be able to see another avenue in which we might be able to get into the market sooner by really focusing a little bit more on our virtual care platform, getting that up and running to a certain place. Even Dr. Oduba was someone who I reached out to talk about this as well. And just those initial conversations really allowed us to think a little bit deeper about our go-to-market strategy. And so now we've kind of switched some things around to really allow us to move quicker into the market while being able to support ourselves to get our wearable device up to a place that it should be and through its regulatory pathway. So, I think we have used, physicians and physician practices in a little bit of a different way because we're quite early, but yeah.
For us, it's quite a unique situation because at the moment, as far as I know, we don't have a dedicated platform for shared medical appointments. However, with a stroke of luck, we were able to hunt down the director for shared medical appointments at the Cleveland Clinic. Cleveland Clinic, as I understood, has done over 250,000 encounters so far through shared visits. And so the director has been very instrumental in helping us identify what potentially, a collaborative effort could be to co-build with them to use their own playbook for shared visits to help inform how we develop our platform. And so we thought, that since we're selling our solution to providers who have private practices and potentially health systems as well, we don't need to reinvent the wheel. We need to go to the people who are doing it already. But they had been doing it on the back of Zoom this whole time because there wasn't a solution like ours specific for that. So it's quite exciting to just see how people are willing to take on new innovative solutions to help what they're currently doing become better, right? And also, the clients we're currently serving, we're a little bit further along because we now have clients, but we consider them as co-builders with us, right? Our doctors and the providers who work with us are mostly, lone private practices trying to be innovative in their clinics as well, but they don't know where to start or how to start. So they use our platform to test out what does a shared medical visit look like, right? Online or in person in my clinic. So that has been an interesting experience for us, just to gain real world experience on how this thing really happens, without having seen any other platform pretty much do it, because Zoom is not a use case for us to test and see how it works, with an electronic medical record for shared visits. So for us, I guess, continuing to build and iterate based on feedback from our current customers, and then learning from, hospital systems that are currently doing it and implementing in their own way is how we're looking to grow and pivot if necessary.
Thank you so much. Thank you so much for sharing your journey, your wisdom, and your accomplishment. This has been very, very exciting. I'm feeling very inspired myself. I'm just looking if there are any questions from audience. So while we are waiting for this, and we do have a few minutes left, I wanted to kind of just, ask you all as physician innovators who have worked in clinical practice, have worked in, health tech industry and others, what are the pearls of wisdom you would like to share with the new clinical innovators and physician innovators who are thinking to go in this space?
Okay, I'll go. Uh, the first thing I would say is the best time to start is now. The industry is so ripe for innovation. I don't know if you've heard this before, but healthcare is usually far behind, fintech and other, tech industries, right? And we tend to be the one with the greatest need. And so I'll say if there's any doctor or innovator out there that is looking to do anything, in digital health, start now. And I guess nothing is going to happen perfectly from day one. So it's going to be a roller coaster ride. So enjoy the ride as you go along.
Kike, that was nicely said. And I want to commend both you and Erika because it's wonderful. I can hear in both your voices your passion in what you're doing, but also your willingness to listen and make things better and adapt. And I think that's so important in all of this space. It's important for us as clinicians too. And I think that resilience and adaptability is really the key. And I hear it in both of you. So I just want to say thank you because it's been wonderful listening to both of you.
And John Murray, you want to share what you should tell the next generation of physician innovators, clinician innovators?
I think that if something is very, very frustrating and bringing you down, there may be a solution. Don't be afraid to look for that solution. Don't be afraid to find like-minded people. I have found some amazing people that feel very much like I do on the best way to navigate primary care now, the best way to use digital technology in what I do. And don't be afraid to seek that out. I think we become so comfortable with the situation we're in, with the rules that are set, that we feel like we can't break those molds, but we can. And so I think that's the main thing that I want to put out there.
Thank you. Yeah. Erika?
Well, again, never practice, but what I would say is, just starting from an early time in your career, from when you get into residency and you start to really get your feet wet in taking care of patients directly and independently, I think that was the time that was ripest for me to really recognize I'm seeing how different, it's that time when you can see how different faculty do certain procedures and understand why is this person doing this like this, and really thinking about steps that you find a lot of people doing workarounds on, and I'm trying to figure out why are we always doing a workaround for this particular step, or why are we super anxious when we get to this step in a procedure. And those were the times when or the most times where you can really build off of your creativity and inquisitiveness and understanding how you might be able to address problems that clearly are problems for a lot of people besides just, you. And so I think just starting from that place, as soon as you get into, start training, really, really keeping your eyes open for ways in which you can recognize that things are not maybe flowing as well as they should. I think that's really important, and how you can actually move forward with an idea. And as the person who is taking care of patients at the bedside, more so than, not to knock anyone who's an MBA or an engineer who becomes the CEO of a company, but it's a very different perspective that you have as a clinician at the bedside when it comes to creating companies and technologies that actually really are addressing problems. There's no better person for that role. And so I think you can really start early in your career, really addressing those things. The other thing that I would say is one thing that we're not taught in school or beyond is ownership of our technologies and our creations. We're taught that we need to get out and write, a grant and write, manuscripts or in journals and things like that. And by the time we put our information out there for everybody to see, we've missed that time period where we can submit a patent and really have ownership of the things that we've created. And so I think one of the charges I would have, for medical education is just maybe really start giving that exposure at a certain point while we're training and while we're learning our craft you have a very unique position in healthcare. You have ideas that are relevant to helping, broader population of patients. And this is how you can protect your ideas, and just understanding the importance of intellectual property, patents, trademarks, all of that, I would say would be another thing as well.
Wow, that was very, very insightful. No, thank you for sharing all the perspective and journey, vision, and wisdom. Really appreciate it. And I would also add to all those amazing comments to sign up on PEN. And I think, I had experience where I have been reaching out to the companies or folks who have ideas and support them in building the right solution. So thank you very much. And I'm going to pass the mic along to Laura.
And for next year of topic ideas, we're happy to discuss this with you. Feel free to reach out to myself, our director, Stacy Lloyd, or to our proxy box, digital.health@ma-assn.org. And thank you all so much. Have a great day.